Hey everybody, it's Russ Curtis, licensed clinical mental health counselor and professor of counseling. I wanted to use Ted Lasso as an allegory for how the things we need to consider when counseling people with anxiety disorder, the number one mental health issue in the world today. And I do love the show Ted Lasso. I think he'd be a great client to work with, probably a little challenging at times. I'm also laughing at this picture because I was trying desperately not to laugh while my son took this photo. So I know it could look a little smug. Anyway, let's get into this. How would I counsel Ted Lasso if he sought my help? All right. First, with people with that are suffering from anxiety disorder, it's helpful to get a medical evaluation just to test to make sure this isn't something related to the heart or thyroid or blood sugar levels and so forth. So it's good to get a medical evaluation. There may even need to be medication so that folks feel that they can just function and that they don't, withdraw from the world. I also liked psychological evaluations, not a lot with a client, but the Big Five inventory, and there's some in the public domain, can give me a sense of personality. And also give me a sense of, I've got profiles that I can look at to see if there could potentially be, any type of personality disorder, because, in first sessions that can be hard to miss, and it's just important to keep that in mind. And then also a symptom checklist, and I've got one in mind that I use that can not only tell me the severity of the anxiety, but also look to see if there's other issues such as paranoia or obsessive compulsive disorder, depression, and so forth. So those two are just nice ones to have to give you a little bit more information about the client. Now, as I'm working with Ted, I would always want it to be present as possible, be as genuine as possible, all those humanistic counseling values, and see his wellness. I don't think that's going to be an issue with working with Ted, but that can be with some clients. And if I'm seeing them as a victim or as people are not cars. They don't need to be fixed. They need to be listened to and heard and understood, and the healing happens within that understanding. And one day we'll have the tools to measure that. Maybe there'll be really inexpensive fMRI machines that we can actually see what's going on and show the client in real time what's going on in the brain when they talk about and talk about their issues and so forth. I want to remind him of the purpose. So here's the deal. I would expect working with Ted would be kind of conversational, and there would be humor, and I would want that, and I would invite it. But I would also want to remind him that this is a confidential space where he can share stuff that he has never shared if he likes to and if he feels comfortable doing that. And that is the purpose of counseling. Not only am I ethically bound to keep confidence, there's circumstances where I would have to break that if he was a harm to himself or others. But also, I have a legal obligation. You can be sued for breach of confidentiality. So I'd want to make him aware that, hey, this is a safe space. Now, that said, Hollywood likes to do it, and they're already doing it with Ted Lasso, the archaeological approach to, mental health treatment, and in that we're going to dive deep and find this root issue. And once that's talked about, then healing is going to ensue. That's not my experience, and I also agree with Irvin Yalom that the archaeological approach is just, not my experience of what helps. I would certainly never put on the brakes. If somebody wants to talk about an issue in their past or childhood that they've never talked about, absolutely that can be helpful. But I want to make them aware that we can just kind of do tea kettle counseling, which is, this is a safe place to come in and just share what's going on in your life, the stressors, the tensions, and so forth that they experience, as well as hopes and dreams and next chapters. So the tea kettle counseling is we can just use this time to let off steam. And as this develops and we find that there are some other issues to process, relationships with parents, past abuse or trauma, then it's a safe space for that as well. Okay, the existential therapy piece is just that sometimes anxiety, according to existential therapy, is a signal to us to take a close look at how we're living our lives and how we're making meaning and what are the values and purpose, and are we in alignment with those values. So anxiety can be a signal that we're out of alignment with that. Now, even in the first session, I'm going to talk about coping skills. Okay, so and particularly CBT, cognitive behavioral therapy, and mindfulness coping skills. I like a term used by John Kabat-Zinn with the coping skills of weaving the parachute, and that we need to be weaving that parachute day in and day out so that when we need it, it works, versus strictly using the coping skill when we're feeling really stressed and anxious. So I want this to become a daily habit. And a piece of this, and I see this missed a lot, and I just think it's really important when working with clients with anxiety, is helping them develop an oh well attitude. And what I mean by that is, if you are working with folks with anxiety and teaching coping skills, they can start to cling so tightly and desperately to the coping skills that it can be helpful, but it's also a part of the tension and stress that they feel like, why isn't this coping skill? I'm breathing, why isn't it working? And so I want them to develop a more casual attitude, and it is hard. I don't want to say that this is easy in any way, but to build the oh well muscle is like, oh well, I am feeling anxious. I'm going to go lay down. I'm going to close my eyes. I'm going to leave this meeting, leave the classroom. I'm going to do what I need to do. Oh well. So there's a combination here. We got to develop that oh well attitude while working the parachute here, or weaving our parachute. Now, some of the things to weave the parachute: mindfulness practice, just sitting for 5 minutes every morning, and coming back to the breath every time our mind wanders off, which will be really frequently. So teaching folks that thoughts are just thoughts, and that we can sit and we get to choose which thoughts we're going to focus on. But thoughts are just thoughts. So that's a part of it, is daily mindfulness practice. And yes, it's nice to be able to sit, and I recommend that, to sit in silence and just focus on the breath. But also we can be mindful while we're washing dishes, while we're eating, while we're walking. So there's all different opportunities throughout the day for mindfulness practice. 4-7-8 breathing, which I first learned in a book from Dr. Andrew Weil. Just inhale to 4, hold to 7, exhale to 8, or whatever count works for the client, but doing like 8 cycles of those, once in the morning, once at night, which actually helps stimulate the vagus nerve, which helps regulate the nervous system. So this is something that we're going to do this every day, and you can do it clearly more than twice a day, and we can also use it when we're feeling stressed, but it will help if we're weaving that parachute by doing it every day. It also helps us to recognize that oftentimes we're shallow breathing and we're holding our breath even when we're not consciously aware of it. And so 4-7-8 breathing is a nice way to say, hey, this is what a deep, full breath feels like. And then lastly, we may do some progressive or autogenic relaxation so that he gets a real feel for what it feels like to have a relaxed body and to be present in the moment. I prefer autogenic. Some people prefer progressive muscle relaxation, but that would be something that we could try and do each session as well to weave that parachute. All right, let me know your thoughts on this, and I will talk to you soon on the next video. Take care.